Hey everybody, Dan here with Pain Free You. Today's topic is going to be another one in the Is This TMS series. Is pelvic pain and pudendal neuralgia TMS? And I will say, I'll get to that in a minute. We're going to take a couple of breaths. Breathe in the peace. Exhale the noise. Breathe in the calm. Exhale the stress. Breathe in the clarity. Exhale the doubt. So is pelvic pain, pelvic floor dysfunction, pudendal neuralgia, even some urinary issues, frequency, urgency. Are these things TMS? And the simple answer is yes. Right? Almost doesn't matter how they started, but let's talk about that anyway. In some cases, these things can start up randomly, seemingly out of nowhere. Sometimes it starts out as, a UTI, urinary tract infection. And sometimes, even after the course of antibiotics, the symptoms of the UTI don't dissipate. They don't go away. And so, very sensitive part of the body, both for men and women. And this is not just a female issue. There are plenty of men who also have pelvic pain, testicular pain, urinary frequency, urgency challenges, issues. But as you can imagine, it's a very sensitive part of the body. Means a lot for a lot of reasons, because we use it a lot. We're going to the bathroom, all the time. Sexual function, sexual pleasure. There's a lot of weight to that topic. And when people suffer these types of pains, they're not able to participate in sexual activity with their partners. And that leaves a lot of emotional pain surrounding it, which gives the entire thing a much more significant, significant importance or outcome or weight to it. And bottom line is, through fear and attention, virtually any type of symptom we can experience for medical reasons can persist. The brain can learn to keep them going. And so, simply put, pelvic pain, pelvic floor dysfunction. I've talked to I don't know how many people that have gone to pelvic floor therapy. And I can't even imagine some of the invasive things that these pelvic floor physical therapists are having these people do, these women do. And I've not heard anybody suggest to me that the pelvic floor therapy has been the answer. Maybe some slight relief, but I've never had anybody say, yep, that fixed me. No. That's a given, because they wouldn't be talking to me if, in fact, the mainstream medical world had been successful for them. But I don't think it is, because the internet is littered with people suffering from a whole variety of pelvic floor, pudendal neuralgia, pelvic pain, frequency, urgency, IC, embedded bladder infections, all these medical diagnoses, and very little hope or solution. And I will tell you that I have absolutely either coached with or interacted with via Facebook, YouTube Messenger, or YouTube comments, people who were able to apply this mind-body TMS, stress reduction, changing your belief about your body and the cause of the symptoms by utilizing these concepts that I talk about all the time. I have met quite a number of people who have gotten better. If that's you and you'd like to share your story to give a little bit of hope to the rest of the people out there suffering with these types of symptoms, reach out to me. I'd love to do an interview with you so we can share the positive news. Because it's like any type of symptom that the brain has kind of latched onto and has memorized and learned and keeps persistent through fear and attention. The key is to determine that there's nothing significant going on. And, a doctor telling you, well, sounds like you've got a pelvic floor dysfunction. In my opinion, that's not significant. It's not life-threatening, right? No tumors, no cancers, no infections, right? And infections do respond to antibiotics. So if there's a UTI infection and that's been cleared up with antibiotics, but yet the symptoms persist, that's TMS. That's learned pain or learned symptoms. And it's very, very common. And the more fear and attention we give these symptoms, the more likely it is for them to become learned and stick around. So a lot of the solution is accurate knowledge that you're really not ill. You're not sick. You're not damaged. You're not broken. This pelvic pain can be really challenging for a lot of people. Create a lot of issues with sitting, riding bikes, sex. All sorts of physical activities are limited by these perceived problems in the pelvis area. And again, I believe it's all learned pain. The more fear, attention, focus, despair that you've got about the symptoms, the more likely they are to stick around. And so, the location of the pain does not matter. And some people will say, well, I wish I just had standard back pain. And for anybody who's suffered with long-term, crippling back pain, you'll say, that's no picnic either. Comparison is just guaranteed to make you feel worse. The concept of nobody understands how bad it is. These types of thoughts make the pain worse and cause them to stick around longer. And there's no contest. There's no prize for the person whose pain is worse than the others. There's no winner here. And so comparing yourself to others and saying, I'm a special kind of broken because I've got the worst kind of pain, will just virtually guarantee it's going to stick around longer, right? Understand that TMS, this mind-body syndrome, this learned pain, can be very significant, devastating to some, and it doesn't matter where in the body it is. It's all the same challenge. The solution is all the same. We don't have a different solution for TMS in the pelvis that we do for TMS in the back or shoulder or neck or headaches or whatever. The solution's all the same. Accurate knowledge, you're not broken. There's nothing wrong. Take those medical diagnoses and labels, drop them in the trash can. There is very, very little evidence that pudendal neuralgia is due to nerve damage. I worked with somebody who was told by her doctor, yeah, your pudendal nerve must have gotten damaged in childbirth. But she was told this when her child was 3, and the pain just came on 3 years after childbirth. So how could it possibly be the childbirth? And so the doctors are well-meaning, but when they don't have an answer to the significant amount of pain, sometimes they just default to the labels that describe the symptom. So people with pudendal neuralgia have X, Y, and Z levels of pain in these locations, period. And that's how they're making their diagnosis, based on purely the patient's or the person's description of their pain. That is not a diagnosis. That is connecting the dots loosely that says, well, if you feel these symptoms, then you must have this. It's kind of like fibromyalgia. If you've got these types of symptoms, you've got fibro, but there's no test to prove it. And for many of the pelvic types of pains, the tests come out clear. people with the feeling, the sensations of repetitive urinary tract infections, oftentimes those tests come out clear. There's no bacteria present. But the fear of a UTI can cause the brain and the nervous system to respond as if that's actually going on. And that can create the frequency and the urgency. And the more fearful we become about that, the more it persists. So at the end of the day, accurate knowledge and knowing that this is all a mind-body learned set of symptoms. The medical label that you've been given by your doctor is just that. It's a description on a piece of paper. It doesn't mean you're broken. It just means that that's what they call it. But now you know the accurate information is that it's the mind-body syndrome, TMS, this learned set of symptoms. And if the brain can learn it with fear and attention, take those two things away, and you can unlearn those symptoms. They can go away. They can fade away. And I do understand how scary these symptoms can be. But the severity of the symptoms doesn't mean anything with regard to whether or not it's structural, physical, infection-based. The severity of the symptoms really, in my opinion and experience and paying attention to this stuff for a couple of decades here, the severity of the symptoms absolutely is based on the amount of fear and attention you give those symptoms. And so the way out is to turn around, take away the fear, take away the attention, soothe, calm, breathe. There's nothing to fix, there's nothing to heal. It's a teaching process, and we have to teach the brain with consistent messages that you're actually okay already. So yes, pelvic pain, pelvic floor dysfunction, IC, frequency, urgency, UTIs or frequent UTIs where the bacteria is not present. All of these things, in very many cases, these things are TMS, the mind-body syndrome, learned symptoms, and therefore can be unlearned. So that's what I got for you in this video. I hope you're liking these videos in the series of Is This TMS? If you have a request for one, comment below. I'll see if I can tackle it for you. I do have a few more that I'm going to be tackling over the next several days. So we'll get to those. But love you guys and gals. Hope you're having a great weekend, and we'll talk to you tomorrow.